Now, Halloween weekend's going to be just gorgeous. Many older adults are living on fixed incomes or are just looking for ways to save money. Have you ever wondered if there are ways to save on your Medicare costs? Well, you might be surprised to find out you are eligible for savings. Mike Knight from People's Health is here to explain more. Good morning, Mike. How are you?
Good morning, Tommy. Thank you for having us on this morning. You're doing well.
Good, very well. Many people may be confused about the difference between Medicare and Medicaid. Can you explain?
Yeah, so Medicare is a health insurance program funded by the federal government, and it provides health care benefits to individuals that are generally 65 and over, and then those that are younger on disability. And then you have Medicaid, which is a joint federal-state program, and what that does is it pays medical costs for certain people and families with limited incomes and resources.
So can you have both Medicare and Medicaid?
Yes, you can. And so what happens with that, they're two separate programs, but they both help with healthcare costs and can work together. Medicaid will pay the costs not covered by original Medicare. It can include additional benefits such as coverage for prescription drugs, eye care, long-term care. If you don't qualify for full Medicaid, you may qualify for one of the 4 Medicare savings programs.
So what are those? What are Medicare savings programs?
So the Medicare savings programs, they're for people who have limited income. They help cover Medicare premiums and costs like deductibles, coinsurance, copayments. There's 4 types of savings programs, and each one of them has its own income limits. So the first one that you have is what's called the Qualified Medicare Beneficiary Program. It's called QMB for short. And what it does is it pays Part A and Part B premiums. It also pays for Part A and Part B deductibles, copayments, and coinsurance. Then you have what's called the Specified Low-Income Medicare Beneficiary Program, or SLMB for short, and that pays the Medicare Part B premium. The next one is called Qualified Individual Program, which is called QI, and it also just pays the Medicare Part B premium. The last one we don't see as much of, and it's called the Qualified Disabled and Working Individual Program. What it does is it pays a Part A premium, and you may qualify for this if you're working and you're under 65, if you lost premium-free Part A when you went back to work, if you're getting medical assistance from the state, or if you meet the income and resource limits required by the state. There's other benefits to the Medicare Savings Program. One is those who qualify don't pay a late enrollment penalty for Medicare Part B. Medicare just waives that penalty. And then Part B late enrollment penalty is an amount that Medicare requires you to pay if you don't enroll in Medicare Part B when you first become eligible. Another benefit is you automatically qualify for extra help programs when you're on the Medicare Savings Program.
Man, a lot of stuff. It can seem confusing. What is the Extra Help Program?
So Medicare's Extra Help Program, what it's going to do is it's going to assist people that have a limited income and resources, help pay their Part D as in prescription drug program cost, including deductibles, copays, coinsurance. It also may help pay your Part D plan premium. Keep in mind, you do need to be enrolled in a Medicare prescription drug plan to get extra help, but you do not need to be enrolled in the Medicare Savings Program, so you can have one without the other. If you qualify extra help, the Social Security Administration will send your information to Medicaid automatically to see if you qualify for a savings program. And then there's 2 different kinds of extra help. Depending on income and resources, you may qualify either full or a partial extra help. Both help pay for drug costs. But when you have extra help, you're assigned a level, and it goes by a limited income subsidy level of 1, 2, or 3, or 4. And basically what these do is they tell you what you're going to pay for your prescription drugs. The main difference is level 1, you pay your entire Part D premium. Other levels, you'll only pay a portion, if anything at all.
And who is eligible for those programs you mentioned?
To be eligible, you must already have currently qualified for Medicare Part A. And then your income and resources they'll take a look at. They have to be below a certain amount. The income amounts are based on family size, federal poverty levels that the government releases each year. And these do change annually. Because of this, your eligibility program can change year to year. So if you didn't qualify before, you may want to check again, and you can always find out about those limits at Medicare.gov.
And you mentioned the eligibility is based on income and resources. What do they consider a resource?
So resources are going to be things that you may have: cash, money in bank accounts, stocks, bonds, property, houses you own, estate property, cars, trucks, boats, vehicles beyond one that you use. And then they'll take a look at life and burial insurance and those kind of things. Now, things that don't count as resources. You can own your own home and then the one car that you own, any furniture or other household and personal items. A burial plot is excluded, and then $1,500 for burial expenses if you put that money aside. To find out more about what's considered a resource, go to Medicare.gov as well.
We're talking to Mike Knight with People's Health about how to save money on Medicare. WWL First News Time, 8:20. When we come back, we'll talk about how do you apply. Right now, though, let's take a look at traffic. 8:23 WWL First News Time. I'm Tommy Tucker on this Thursday, October 28th, day 60 of the Ida recovery and the first anniversary of Zeta slamming into the coast, a rare fall hurricane. We're talking with Mike Knight, People's Health, about ways to save money on Medicare. So, Mike, how do you apply for some of these different programs?
If you think you might qualify, you can apply several different ways. The first one called Medicare, and that's 1-800-MEDICARE. That's for the Extra Help program. You can also call Louisiana Medicaid at 888-342-6207 if you think you might qualify for Medicaid assistance. You can also go online to their website, which is medicaid.la.gov. And there you can click the blue Apply or Renew Medicaid box. You can also call Social Security Administration, and that's 1-800-772-1213. Another really good resource that doesn't get a lot of credit, but I mean they're wonderful people, the Senior Health Insurance Information Program of Louisiana. It's also known as SHIP. You can call them at 1-800-256-5300. Or you can also call People's Health at 1-800-978-9765.
Well, if somebody's listening and they don't qualify for those programs, are there any other ways to save money on Medicare?
Yeah, absolutely. Even if you don't qualify for one of these options, choosing the right Medicare plan can help save you money. There's many different options when it does come to Medicare plans. You have to do your research and decide what plan has the benefits and costs that work for you. However, Medicare Advantage typically will save you money because you know the cost up front for services. Original Medicare, there's no limit to your expenses, but Medicare Advantage plans, you have a maximum out-of-pocket limit. A lot of them also include a variety of benefits bundled into one. It'll have dental, vision, fitness club memberships. These benefits aren't included in original Medicare, and you would have to purchase them separately.
So how can people find out more about People's Health?
You go to peopleshealth.com. You can call 1-800-978-9765. You can visit us here at the People's Health United Healthcare Medicare Center at 3017 Veterans. I'm here a lot of times. We also have some other reps that are here. Appointments are recommended. You can walk on in. Those are welcome as well. Follow us on Facebook, Twitter, or Instagram.
Thank you, Mike. Anything you wanted to add, or have we about covered it?
Well, no, one other thing. I mean, this is the enrollment period. It runs through December 7th. So if people are looking to see what options they have, come by and see us. We're more than happy to sit down with them, see if it's going to be a good fit for them. And that's about it, you know.
All right. Thank you, sir. I appreciate your time. Have a good weekend.
Tommy, you too. Thank you.
You bet. You can go to peopleshealth.com. You can call 1-800-978-9765. And you can visit the People's Health United Healthcare Medicare Center, 3017 Vets in Metairie next to Party City. Appointments are recommended. Walk-ins are welcome. Not quite sure about the mask policy here, given the new mandates from the governor or lack thereof, but I would call first just to make sure. Bring one with you. You can always put it in your pocket. And you can follow People's Health on Facebook, Twitter, or Instagram.